Have you ever felt certain you were coming down with the flu, only to have a test tell you otherwise, leaving you puzzled about what to believe? It is a common scenario that can be quite confusing when you are not feeling your best. Yes, a flu test can absolutely give a false negative result. This means the test indicates you do not have the flu, even though you are actually infected with the influenza virus. Understanding this possibility is important for effective care. There are several key reasons why a flu test might miss an infection. One major factor is the timing of the test. If you get tested too early in the infection, before your body has produced enough viral particles, the test might not detect the virus. Conversely, testing too late, perhaps more than 4 to 5 days after symptoms begin, can also lead to a false negative because the viral load in your respiratory system may have decreased. The type of test also plays a role, with rapid antigen detection tests generally being less sensitive than molecular tests like polymerase chain reaction or PCR tests. Furthermore, the quality of the sample collection is crucial. If not enough nasal or throat secretions are collected, or if the sample is not handled properly, the test might fail to find the virus. So, if your flu test comes back negative but you still strongly suspect you have the flu based on your symptoms, it is important to discuss this with your doctor. They will consider your symptoms, your overall health, and any potential flu exposure you have had. Your healthcare provider might decide to treat you based on your symptoms alone, especially if you are in a high-risk group for complications, or they might recommend a different type of test for confirmation. When doctors talk about test accuracy, they often use terms like sensitivity and specificity. Sensitivity refers to how well a test correctly identifies those who actually have the disease. Flu tests, especially the rapid kind, have variable sensitivity, meaning they can sometimes miss cases. Molecular tests like PCR are known for their higher sensitivity. Another interesting detail is that different flu strains can sometimes be harder for certain tests to detect, adding another layer of complexity. Ultimately, your symptoms and your doctor's clinical judgment remains paramount, even with a negative test result. Trust your instincts and communicate clearly with your healthcare provider, ensuring you get the most appropriate care and guidance, regardless of what an initial test might suggest.